Good evening and a warm welcome to our webinar tonight, Beyond Consent, Assisted Suicide Through a Family's Eyes. My name is Gillian Wright and I was formerly a palliative care doctor, but now I work for the campaign Our Duty of Care, which is part of the Care Not Killing group. We are keen to connect and encourage and equip healthcare professionals who have concerns about assisted suicide and euthanasia within the UK. Tonight, it's a real privilege of mine to speak with Alicia Duncan, who has travelled from Canada to the UK to tell her family's really difficult story. Alicia's mum, Donna Duncan, died by assisted suicide in 2021. And thank you all for joining us tonight. If you have a question for Alicia, please do put it in the chat function and I will ask it at the end of our session together, which we hope to finish about 6:45. So thank you again for joining. So Canada legalised euthanasia in 2016, and it's often referred to as medical assistance in dying, or MAID. And it's particularly relevant to our time just now because both Scotland and the UK as a wider jurisdiction are considering the introduction of assisted suicide, sometimes called assisted dying, with key votes in the next few weeks. So welcome to Scotland, Alicia. It's lovely to have you here, and we've even managed a little bit of sunshine in Edinburgh today. So thank you for coming and joining us.
Thank you for having me.
I wondered if we could start, perhaps. Maybe you could just tell us a little bit about your mum, if that was okay.
I would love to. As you mentioned, my mom's name was Donna, and she was a spectacular human being. There's no other way to describe it. She was the glue of our family. She loved to host dress-up parties and decorate for the holidays. She was this person who kind of looked into your soul when she spoke to you. She's a psychiatric nurse with over 4 decades of experience caring for people. She believed in compassion. She believed in healing. She loved to travel. We traveled the world together. And she was my best friend.
Oh, well, thank you so much for just giving us a little glimpse of her, and thank you, Matt, for showing us the photographs. Please, can you explain to us what happened to her, and then the effects on you and your family? Thank
Yeah,
you.
absolutely. So in February of 2020, my mom was in a minor motor vehicle accident and suffered a concussion. And over the next 18 months, her health rapidly deteriorated. The doctors could not figure out the reasoning for her weight loss, which was quite extreme. They ruled out everything from cancer to fibromyalgia and everything in between. And it was a few months before her passing that we speculated this might be a psychosomatic condition, that it was mental health, and that she was actually restricting her diet. And we tried to intervene. We tried to get her help. She assured us that, she was doing everything right and we just needed to trust the doctors. And it wasn't until 2 days before her initial MAID appointment that she told us she had applied to end her life and had been approved, and she was going to die in 48 hours.
Mm.
So it was obviously very shocking. My sister and I couldn't believe that this was even happening. My mom was not terminal. She had no diagnosis other than depression and post-concussion syndrome. And so we went to the police because we felt this needed to be stopped. This was a nightmare. It was a mistake. But the police confirmed that, in fact, she did have all of the paperwork in place. Somehow she had been approved. And the only way that we could potentially stop this was to get a court order from a judge. And so that is what we did. We went to the provincial courthouse and we petitioned a judge for her arrest under the Mental Health Act. And we had enough evidence to prove that her capacity should be questioned. And my mom was taken into custody and assessed. And because she was a psychiatric nurse, we believe she was able to pass the assessments to show that she had mental capacity when we believe and still believe that she did not. However, the psychiatrist postponed her May appointment and said that further assessment needed to be done. And my mom was so devastated, she attempted to take her own life. It was at that point that she was actually sectioned under the Mental Health Act for a 48-hour involuntary hold. And my sister and I were actually relieved at that point, if you can say that. I mean, it was a terrible position to be in. Obviously, we were devastated, and but we felt that she would be safe from herself and from the doctors. But unfortunately, in Canada, after 48 hours, you need to be assessed again. And once again, my mom passed the assessment for her capacity. And 4 hours later, after being released, we received a text message from my mom's common law partner to let us know that my mother was dead and her body had been taken to a crematorium. So
that's devastating. Yeah.
It was beyond devastating. I cannot explain the pain that I felt in that moment. It quite literally felt like someone was ripping my heart out of my body. It was a physical pain, so intense. My daughter was in the living room when I found out, and I was down the hall, and she said she heard me scream, a primal scream, something she's never heard before. And it was horrific. That's the only way to describe it. It was absolutely horrific. What happened?
Yeah, no, go on. Sorry, go on.
I was going to say, in the months following this, my sister and I we just couldn't make sense of it. It still didn't make sense. We didn't know how this happened, and so we started reviewing her medical records. So as the executor of her estate, I was given her medical records from her GP, and we compared it to the legislation in Canada. And in Canada, it's very interesting because it was legalized in 2016 for people with terminal conditions only, and there was a set of safeguards put in place for that. And then in 2021, it was expanded for people that did not have a terminal illness, but they had a condition that was incurable. And that is now considered track 2. And we could not rationalize under either track how the safeguards and how the requirements were met. And so we presented that to the police in the jurisdiction where my mom lived, and the police agreed and launched the first investigation into a May death in Canada. And unfortunately, after 8 months of investigation, because the health authorities refused to release her assessment records, the investigation had to close. And so that really started my advocacy work in this. We've been working for almost 3 years now trying to get her assessment records. And through the Privacy Commission, they have just recently ruled that we will not be getting access to the assessment records, that a person's right to privacy remains even after their death. So there's no way that we can prove the criminal negligence that we believe happened in her case.
That's very hard. And how did all this affect you and your family afterwards?
My sister and I have both been diagnosed with PTSD since this happened. It's torn our family apart in ways. My sister in that photo, we've become very, very close, bonded in our trauma. We have gone through and continue to go through a lot of therapy to be able to just face what we need to face every day, which is that my beautiful mom, who had decades of life, presumably ahead of her, and will no longer be with us. We have not spoken with my mom's common law partner since her passing. He had been in my children's life since they were little. My children believe or feel that they lost their grandma and their grandpa that day.
Sure. And I know you have great concerns about how she was assessed and how the situation was reviewed. Do you think there are lessons then to learn for those who are legislating at present? Are there things that we can learn in the UK about the experiences in Canada? What kind of advice would you give us as we're facing this issue for the first time over here?
Absolutely. The first time I reviewed the bills that are being proposed, I was shocked. I was absolutely shocked because what you are being proposed in the UK and in Scotland um, is eerily similar to what we were promised in Canada in the beginning, was that this was to be a compassionate act for people at the end of their life who were suffering.
Mm.
But because of the ambiguous terms in the bill, similar to the ambiguous terms in the Canadian legislation, people like my mom with no terminal condition who was starving herself were able to be approved. And there's many dozens and dozens of cases in Canada for people being approved for things that no one would ever approve them for, such as hearing loss. In Canada, hearing loss presumably is an incurable condition because you can't force someone to go through treatment. It's an incurable condition, and the patient just has to state that they find it to be intolerable to them, and they can be approved under track 2. And people might be thinking, well, that's not what our bill is about here in Canada. But what people need to be aware of is that as soon as you legalize something like this, as soon as you open this door, even just a crack, you don't get to decide who walks through. And what I mean by that is that what happened in Canada is that it was legalized for people who were terminal and who were suffering. And people who had an incurable condition said, well, that goes against my Charter of Rights, because who are you to say that my suffering isn't as great as a person who's suffering in the context of the end of their life? And furthermore, we've written a sunset clause to say people with mental illness as a sole condition, who are we to say that a person with a mental condition, such as bipolar disorder or schizophrenia, who are we to say that they aren't suffering as intolerably as someone with an incurable condition or a terminal illness? And so what has happened now is that people have challenged that, and judges have agreed, and the law has been amended to allow people access to this. So currently in Canada, it would be legal already, but we've postponed it twice now. But as it stands on March 17th, 2027, people with a mental illness as sole condition will be able to be approved for MAID.
Mm.
Right now, that mental illness does not disqualify you, though, so it's a loophole. So people with clinical depression who also have hearing loss are being approved, or someone with bipolar disorder who has type 2 diabetes, they just say they're going to stop taking their insulin and they are approved. And so these bills that are being proposed leave massive, massive gaps for people like my mom, or for people who are vulnerable and can't get access to care. There's so many other examples that I could share. People facing homelessness because they can't afford to live because they have a disability and they can't get access to care or access to a wheelchair. These are major issues in Canada, and the UK is not. You won't be exempt from these conditions, because
We
there
have
are doctors.
similar issues. Yeah.
That's right.
Mm.
There are doctors that will take advantage of this.
And I think that's helpful in terms of we often hear or think of assisted suicide or euthanasia as a choice, that people have a choice to make this decision. But I think what's often hard is that people are making a choice in a context of lots of other things going on. And it may be that there are things affecting that choice. Perhaps it's mental illness, or perhaps it's lack of palliative care. And it's difficult to know whether it's a true choice. And I think that it's really important to kind of drill down as to whether or not that's really what they would want, if all things were equal.
Absolutely. And autonomy is such a strong word that is used repeatedly when we talk about these bills. Autonomy above all else. But autonomy without choice is not true autonomy.
Yeah.
And I mean, maybe I could segue into one of my biggest concerns really is that there is a major lack of transparency specifically with the drugs that are being used. So I will be very clear, there has never been any clinical research ever done on the efficacy of these drugs used at these doses. And so there are no guarantees that the people that are having euthanasia are experiencing the peaceful death that they are being told they're having. And that is just so unacceptable. That is so unacceptable. There is no other medical practice ever where we would let drugs go through with no clinical testing done on them. And there are no procedures that are ever done without the patient having full disclosure of the possible complications that could arise. There's no other area of medicine. And which kind of brings me to my point. Is this healthcare? Does this even have a place in healthcare? This is death care. We aren't helping people to live or to be better or to be cured. We're ending their lives,
Yeah,
you know?
absolutely. I think these are questions which arose during the committee, the Leadbeater committee,
Yes.
about, is this healthcare? Is this what a doctor should be doing? Is this part of what the role of the doctor is? And I think there's a really difficult aspect to that in terms of, should the doctor even suggest it to the patient? If we are required, for example, to tell the patient all the options that are open to them, how does that work? Because we may have influence over the patient, and that's hugely difficult. And I think one of my concerns actually about this is about coercion, or when perhaps sometimes we might refer to it as undue influence, and that could be the doctor, but it also could be the family. And I think it's very difficult for doctors to assess patients, and to definitively say that they're not being coerced, because the person may not even know that they're being coerced. I don't know if you have any thoughts about that.
Yeah. Oh man, there are so many levels of coercion that we can talk about. And I think one of the biggest things that's come up when I've been speaking in Parliament in London, and in Scotland this week is that how can anyone definitively determine whether or not there is coercion? And what we've heard is that coercion can only be determined over a period of time and a repeated pattern. And in the context of euthanasia, we don't have the timeline to even to be able to assess this. And the doctors aren't going to have sufficient training. I know that they say that they are, but we already know right now in healthcare, doctors don't have enough time with patients. The healthcare system is overwhelmed. It's the same in Canada as it is here in the UK. And there's no way. Coercion is not a black and white issue. Coercion is subtle, it's nuanced. And if you ask a person if they're being coerced, they're not going to tell you. They might not even know that they're being coerced. So how could they even tell you? When we've been talking to people this week, we spoke to a woman who survived anorexia. She was hospitalized multiple times, attempted to take her own life over a decade, and she survived now and she's speaking out. She's recovered. And she actually talked about the bully. She referred to it the bully that lived in her mind that was coercing her to do it. There was this internal coercion. I think so often we're talking about external coercion. My mom said to me multiple times in the weeks leading up to her death, she felt so sorry for her common law partner because he married someone who was fiercely independent. And she would say, now look at me, referring to her body that was frail, that needed help. She wasn't a burden to us, but she felt like a burden. People with disabilities who face this every day, Liz Carr, I was featured in a documentary, Better Off Dead, with her a year and a half ago. And she said the systemic coercion that she experiences on a daily basis because of her disability. There's another case where a man in Canada had gone to the hospital, and while he was there, a doctor diagnosed him with COPD and told him that he could receive MAID. And of course, he didn't want to live with this condition. He was in his 70s. They provided MAID against his family's wishes within 48 hours. And afterwards, the family had an autopsy done, and there was no trace of COPD. And so that undue influence that you're talking about, people trust their doctors.
Yeah. I think you've illustrated a number of points, and I think one of our concerns as clinicians is that not only do we get diagnoses wrong at times, but we definitely get prognosis wrong, and sometimes we don't know how long somebody might have. Sometimes we can overestimate, sometimes we can under. But it's genuinely difficult to know. And I think the Scottish and the UK bills differ in that sense, in that the English bill has a 6-month prognosis, but the Scottish bill has no prognosis at all. It refers just to those who have an advanced and progressive disease that may reasonably lead to their death, which is an incredibly broad definition. So there are real concerns that, just as you've described, it could be open to interpretation. It could be wider than is intended. And I think we understand the intention of this legislation is often for a very small minority of people who have maybe extremely difficult symptoms, and we understand that. But I think what you've illustrated really helpfully is the unexpected or unintended consequences for lots of other people in our community. I just wanted to say a couple of things to those who are listening. We do understand this is really difficult. It's a really difficult topic, and it might be difficult for some of you listening. And if it is, please, it might be triggering. If it is, then please do talk to someone kind. We don't want you to be distressed by this particular conversation. And please do reach out if it is difficult. And we would be really grateful to have your questions. So if you would like to, then please do put a question in the chat function. I'm sure there are issues which you would like to know about, whether about Alicia's particular experience, or whether about the wider issue of MAID, of euthanasia in Canada, or about the issue in general. How has it worked differently in different countries? And we'd be glad to think about those. I wonder if maybe you could just talk for a few minutes about different experiences. Are there other families, other people in Canada who are concerned as well? How has this changed? Perhaps even just give us a sense of how common it is in Canada now. Is it just restricted to a small number, or has it expanded to more and more people?
Yeah, absolutely. So since it was legalized in 2016, last year, I'm just going to use broad strokes, but approximately 65,000 people have accessed medical assistance in dying in Canada, and those numbers are higher now. But from the latest reports, Canada is very clear. They actually produce a financial report, and the first report that came out in 2021, when they expanded the track 2 to include people just beyond the terminal capacity, the government saved $89.6 million providing MAID versus palliative care. And that's just looking at palliative care. We're not talking about pensions that no longer need to be paid, healthcare for those people, presumably, that were considered a burden, a financial burden on the system. There's a massive financial savings for governments to implement this. And that is so upsetting and distressing for me, because there are people now, particularly elderly people, that are afraid to go to their doctor because their doctor now has a duty to tell them if they apply or if this would apply to them as a treatment option. Okay, and I'm like, a treatment, this is considered to be
Yeah.
part of healthcare, right? You understand, most people over the age of 65 will be approved for this because you will have maybe one, two conditions,
Yeah.
and maybe you are in a depressive state. Maybe it's a recent diagnosis and you're feeling depressed and you need support, but the doctor has that duty to provide you with this option.
And
So
I could just echo that is the model that's proposed for the UK. So I think sometimes we might have the sense that it would maybe be more a Dignitas model, such as in Switzerland. And I think sometimes we could imagine that it might be not within the NHS, or there might be a clinic that people might go to for a small number of people. But actually, that's very different from what is being proposed in the bills. So the Scottish bill is definitely being proposed within the NHS, and actually the information that goes alongside of the bill says that it would be expected to take place in the person's usual general practice. So the person's usual GP would be the person that would be expected to consider that. They have made provision for passing that on to someone else. But I just to underline that is the expectation, that it's within the NHS. And absolutely the same is true for the Westminster Parliament. It's very much within the NHS as a part of medical care. This is an additional service, if you like, that will be provided. And I think that's not what certainly a number of the doctors I speak to are expecting. They were expecting it to be a separate service or a separate provision. And actually, certainly we've learned that, for example, hospices wouldn't have automatic opt-out. If they wanted that, there would be the expectation that hospices or care homes would provide this, as a service. Is that similar? How have things affected hospices in Canada? Would that be similar, or
yeah, I mean, there's a couple of things that you touched on there. So the first one is that the expectation that you would go to your general practitioner, but from people that I've spoken to this week, which is very similar to Canada, is that not everyone has a GP. In
yeah.
Canada, most people go to an urgent care clinic when they have an issue. I fortunately have a GP, and I am generally a healthy person that doesn't have very many issues. When I need to go to the doctor, it takes me 3 weeks to go in. I'm allowed 15 minutes to bring up one issue. If I have a couple of issues that I want to discuss, I've got to make a second appointment. So I'm typically going to an urgent care clinic. In my mom's case, my mom did have a GP, and he had been her GP for 2 decades. My mom went to him
Mm.
to be assessed. He had been taking, care of her health during this 18-month lead up to her passing as well. And he refused to assess her because she had not followed through with any of his recommended treatments. But in Canada, like you just said, you have a duty to assess or refer because this is an option of healthcare and you have to provide all of the healthcare options to everyone. You can't opt out. And so he was forced to refer her to the MAID coordination clinic. My
Mm.
mom was assessed by a doctor and a nurse practitioner. And because my sister and I had gotten a warrant by a third doctor, but that's unusual. And it was actually a nurse practitioner who ended my mom's life.
Mm.
So that is the one big issue. They've
I think that's really helpful, because I think we've lost, it's not exclusively so, but we have lost a sense of continuity of care that might have been present, a number of years ago. And I think that many appointments, well, there's two aspects. Sometimes seeing a GP, they might not know you, sometimes they may know you, but it's certainly going to be possible within the framework that's been proposed in the UK bills that somebody might see you for the first time and approve you, you know, for that first assessment, and then that it will be that there's two doctors as part of the process, but there's certainly no requirement that either of them know you or your situation well. So I think that is concerning, because we imagine that we go to our doctor and they may know that our situation is more complicated, or that there are other issues that arise. But certainly in the framework that's been proposed, there's not going to be that safety mechanism. And I think that, I guess it comes back to the whole issue of safeguards. That has been a resonant theme, particularly in the committee stage, in the Leadbeater process, and and I guess there has been a sense that there's been a real push to have really effective safeguards to protect those who are most vulnerable. And I guess I'm wondering that your sense is that this can't be safeguarded effectively. Is that right?
That is from my experience and what I know, speaking to people over the last 3 years, I will say this because I think sometimes people think that I am just fundamentally opposed
Yeah.
to euthanasia. And in principle, I'm actually not opposed. I don't want anyone to suffer. But what I know to be true is that the way something is designed in theory and the way that it rolls out in practice don't always connect. And what I know to be true is that there is absolutely no way that we can effectively roll this out to make sure that vulnerable people aren't being abused in the system, and that doctors aren't abusing this, and that mistakes aren't made, and there isn't negligence. I want to jump back to, because you did say hospice before. That was kind of the second part of that question. In Canada, hospices are not allowed to opt out. There was one hospice that I know of near where I live, and when they said this goes against everything to do with palliative care, we're not going to provide this, the government defunded them and actually evicted them from their building that was on government land 15 years early that they had personally fundraised for and built. And so now they've been brought, back to ground one to fundraise again for a private clinic. The control of the government is so upsetting, because now that duty of care to provide this, there are elderly people in hospital and family members that are deeply concerned because doctors are constantly pushing medical assistance and dying on patients when they're in hospital. And people are afraid that their loved ones are going to come to the hospital and find that their loved one is dead because they were left alone. So now there's groups of volunteers that are volunteering to sit with people that don't want to be euthanized because doctors are preying on them.
I think just in terms of clarity, actually, we should probably say that the UK bills are not proposing euthanasia. So just in terms of what is being proposed is assisted suicide, so that the doctor will prescribe lethal medication that the patient takes themselves, whereas in Canada that's part of it, but it's also possible to prescribe lethal medication and for the doctor to administer it. So usually we refer to euthanasia as the administration, and assisted suicide as when the person takes himself. And I think one safeguard that both bills have proposed is that it would be the person taking it themselves. I think that actually brings more practical problems, because sometimes there are practical problems with a particular oral medication. People can be sick. Sometimes it doesn't work. So there are their own problems. but I guess just in terms of clarity, the UK bills are not proposing euthanasia itself, but assisted suicide or what's called assisted dying in our context. But I think it's really helpful to see how the assessments of capacity, the assessments of coercion, the assessments of whether somebody has a terminal illness, whether they are, what their prognosis is, and actually how difficult it is to make these decisions. They are universal, and these are the difficulties that we face in medicine, and the complications, the uncertainty that is part of looking after people and their families, and actually sometimes brings the great joy of of looking after of people. But it is so difficult to know that the actual time that somebody might die, and the actual plan for them. So I think there are real similarities with the Canadian situation, although there are some differences.
Yeah, and there definitely are differences, and in Canada, people do have the option for both, but it's primarily euthanasia where a doctor is lethally injecting
Yeah.
patient. But you did touch on something really important there that I do want to talk about is during the assessment process, something that is common with both of these bills that are being proposed and the Canadian legislation is the lack of family involvement.
Yeah.
And one of the things that's really concerning, obviously, as a family member that tried to stop this, not only was there lack of family involvement, my mom was very controlled about what she told the assessors to be approved because, and I know that if she told the assessors what she was telling us,
Mm.
um, I don't know if she would have been approved. She was very controlling because that's what she wanted. She was anorexic. She was starving herself and she wanted to leave her body and she was going to do anything to make that happen. But there's lack of family involvement in the assessment period. But again, what we touched on before, there are no systems that have been put in place if something goes wrong. So if there is negligence, and someone dies and the family believes that something did go wrong during the assessment period, there's nothing in place for people to find out more information. In our case, we had gone to the College of Physicians and they said it was a criminal issue. We went to the police and they went back to the health authority and
Yeah.
tried to get the assessment records and they were denied. And so everyone has just kind of put their hands up and said, well, not our problem. And
Mm.
now we'll never know. And it's everyone's right to, if you die, it should be lawfully. And that is really upsetting for me to see in these bills as well, because there is no way for families, to challenge it afterwards. Who's
Yeah.
liable?
Yeah, I
Who's
think that's
liable?
really helpful. And I know we actually have a question in the chat, and I think I must apologize. I think the chat was maybe closed initially, and so I'm sorry to all those who maybe have had questions. But somebody's asked about family involvement in that decision process, and I think that's really helpful that there doesn't need to be family involved to support somebody. And I think sometimes, like you were, only informed that it was going to happen when the decision had already been made, which is hugely distressing. Um,
Yeah,
one
I
question, sorry, just in the chat. Is there any prospect of things rolling back in Canada? Are there concerns, or do you think that it would be difficult for that to happen? Now, I guess there's it's currently political change in Canada at the moment, and you're awaiting a new government. So I guess it will depend a little bit about what happens then. But do you think things will just progress, or is it interesting, for example, that there's been a halt on psychiatric euthanasia?
I mean, it is such a political issue. We have our federal election in 4 days, and Not a lot of parties are coming out directly saying what their stance is on this. We do know that the Green Party in Canada, which is very different, it's a very different platform in Canada than it is here in the UK, but the Green Party is the only party that has said that if elected, they would roll it back. So to try to eliminate track 2, so it would go back to track 1. And just for anyone that is tuning in here, the Green Party federally has never been elected. It's not a very strong political party, so I don't see any chance of them actually getting into power. The Conservatives have essentially said that they don't plan on rolling it back, but they also don't plan on expanding it either. And I would expect, just based on the history of the Liberal Party, that the Liberal Party would be supportive of expanding it. However, during 2021, when they were, or after 2021, when they did the expansion with the sunset clause, they created a committee called the AMAT committee, and it was developed with researchers and medical doctors and psychiatrists to research this. And basically what was said is that there is a 50-50 chance someone will recover from a mental illness, and that is why they continue to push it back. And so I really hope that it won't expand any further. I would love for it to roll back, but I don't see that happening anytime soon.
And I think it is difficult. I think it was interesting that there was a certain amount of outcry when the psychiatric euthanasia or mental health euthanasia was proposed, and internationally I think there was certainly awareness when there'd not been before, and that the pause would seem to be significant, certainly. But yeah, it's interesting to see how things will develop. There's just a couple of questions. One about power of attorney. Does that make a difference if someone had a power of attorney? Does that mean that someone couldn't have made, or is that
So there's a couple of issues here. I mean, there's consent. So power of attorney typically applies to someone if they've lost capacity.
yeah,
And so if that person has lost capacity, then they currently in Canada, and I don't know how it would roll out here, but they couldn't have approval anyway. But then the second part of that is in Canada, they are considering legalizing advanced directives. So
yeah.
for people that have a diagnosis of dementia, they can write in their advanced directive that once they reach a certain point, that they can be euthanized. But the trouble with that is Quebec is already rolling this out, and it kind of looks like slipping sedatives in someone's tea, and then when they're sedated, then they're injecting them. But the problem is that if that person in that state says, I don't want this, or no, or they start fighting, they can't go back because they are no longer sound of mind. So they have to follow through with what their previous version said. So anyway, that was a bit more
I
involved
think
with
there's just so much that we could talk about. There's so many
that.
issues, and there are a few more questions. I would really encourage everyone who has a question, please do contact us. We are, Alicia is happy to reply, and if you contact through info@rgtofcare.org.uk, then we can certainly answer your questions and put them to Alicia. We've just got a couple of minutes, and I just want to say thank you to Alicia for being with us in Scotland today and speaking to MSPs this afternoon. And it's just been a really helpful explanation of how difficult things can be, and how there are genuinely unintended consequences for vulnerable people by this legislation. But also, I just really encourage all those of you who are here tonight that this is a really big issue for the UK just now, and there will be a decision. So please do take part. Please do find out as much as you need to know. Please do contact your MP if you're in England and Wales, your MP and your MSPs if you're in Scotland. And please do write to them, speak to them on the phone or by Zoom. but also it's really helpful to speak to them in person. We know this is a really sensitive, thoughtful, difficult topic, to be honest, and there's distress on both sides. It's not helpful to polarize it in that sense, but to have a thoughtful discussion, appreciating the suffering that people might go through, but what the possibilities are for really good, effective palliative care and psychological support if we were really to back those properly as a society. Talk through the difficulties of that, and also the impact on others in our society that assisted dying would inevitably have, for those who are lonely, for those who are depressed, for those who are homeless, for those who have no one else, to have no advocate, who have no one to champion their cause, who don't have a GP that knows them. And it's helpful to talk that through with your MP. If you have any problems, please do get in touch and we'd be delighted to help you as best we can. So thank you so much again, Alicia. Thank you for your time. And thank you to all of you for coming tonight and listening to this time together. And I really appreciate that everyone has made the effort. If we can be of any help, do get in touch. And it's just my pleasure to wish you a really lovely evening. Thank you.
Thank you.